Clinical Telemedicine, Part 2, Question and Answer Series. What type of equipment do I have to purchase? Most offices already have the equipment necessary for a telemedicine practice. A PC with a broadband internet connection and a video camera like Microsoft 6000X, which one I'm using here, which is cost about $75, and that's all is necessary. A high-end Tamberg video equipment such as the Intern MXP is also available and may be necessary in some circumstances. What is cloud computing? Well, cloud computing is the cloud-based development and use of computer technology. In concept, it is a paradigm shift whereby the details are abstracted from the users who no longer need knowledge of, expertise in, or control of the technology infrastructure in the cloud that supports them. Typical cloud computer providers deliver common business applications online which are accessed from a web browser, while the software and the data are stored on the servers. And to paraphrase that definition a little bit, it's basically all your applications and are sitting on a computer in this case is in Redmond, Washington, where Microsoft has a data center. They have spent $2.6 billion building these data centers, and we're using their technology. We're using their all their email servers, video conference servers, their database, SQL database. So all that is sitting up in the cloud, or in that case from the internet base in Redmond, and then we're just accessing it, and we're just buying a license to access and use it. That way, who else could support their systems better than them? So they have the technicians. They wrote the software. They have the technicians and all the technology there to be sure that everything is up and running efficiently. Why can't I use services like Skype, AOL, Microsoft Messenger? Well, Skype, AOL, and Messenger are all public networks where the cloud services from Microsoft and Oracle are a private and guaranteed secure network. Only authorized users of this network are allowed to send to, receive email, video, and share documents. Skype and other teleconferencing services are in the same category as fax and telephones. HIPAA specifically states that the EPHI that is transmitted through fax and telephone is not covered by the security rule. And EPHI is, by the way, is the electronic patient health information. Does telemedicine and EMR meet the HIPAA electronic security rule? Absolutely. Inbound and outbound messaging, email, video, patient scheduling, and patient records are restricted to only authorized personnel in the group. So what you're doing, you're set up a group that is a secure group of only the authorized doctors and nurses in your office, and they're the only ones that can access those records. Our cloud servers are also incorporate what we call Microsoft Forefront, which is a high-level security program that will expel and report any authorized attacks on the system outside the authorized group. I just heard something the other day that people were paying, or people paying hackers $15 a patient to get that information, and that's pretty high. So what means that with the Forefront technology, it will not allow anybody into your office, into your records, unless you're on that security group, and Microsoft guarantees that data is secure. It also meets what we call it meets all the standards for data that HIPAA requires, because also we have automatic disaster recovery. So, for instance, your office, say for instance, gets hit by a hurricane and takes everything out, or floods, then but all your data and your patient information is secure because it's in a server, stored on a server in Redmond. How can telemedicine help my practice? Obviously, a doctor needs to physically see the patient for most initial consultation, but many times the physician only needs to visually interact with the patient and review their updated medical records. The patient may be in a remote clinic, assisted care facility, etc. The doctor can log in to his secure network from any internet connection and consult with the patient. This dramatically improves efficiency. At our clinic, our doctor was seeing a new patient every 10 minutes from 5 different clinics in 3 states. Other than telemedicine, what other services are available? Patient scheduling has been the most popular. Multiple doctors and nurse practitioners in multiple clinics can provide for a very difficult scheduling problem. Our secure calendaring system allows the selected group to see the calendars of all doctors and nurses side by side to assist in the patient scheduling process. The beauty of the cloud server is that no matter where the clinics are or where the doctor is or the nurses are or the MAs that need to do the scheduling, they can log in and see the schedules anytime, and they can be updated from anywhere. So for instance, you have someone working from home. I used to have our doctor wasn't available on a Wednesday, so instead of having my nurses come into the office when we didn't have many patients at that time, I let them stay home, had the telephones forwarded, and they could just do the scheduling from inside their own homes. Of course, they were not taking any data out of the building. All the data stored up right on the cloud server, and all they needed was the login, and they could actually log in and make the schedules from that point. What is Microsoft Health Vault? Today's healthcare system is complicated and cumbersome. Health information is stored mainly on paper and is scattered and disconnected. A patient may have health records with several doctors, hospitals, and clinics. Medication and prescription history may be spread across several different pharmacies. Self-care information such as diet, exercise, routines may all unavailable. Any changes or updates to these records may never reach the treating provider. Health Vault lets people consolidate their information into one easily accessible account to help them become more informed and active in managing their health. And basically what we do is that we have routines that basically all your information at your clinics can be immediately uploaded into the Health Vault. The best way to do this is charge a fee for it. It's a way to make money, but also it's also a way to make sure that the patient has all their information in a centralized source. Can I use my notebook, computer, iPhone, or smartphone? Absolutely. The patient data is stored in the cloud computers and not on your iPhone or smartphone. So if you lose your phone, unless they know your password and username to the cloud server, they will have no access to any data or patient records. How long does it take for installation? Generally, for a small clinic of 5 users, it will only take 2 days. End-user training is provided by online classrooms, and the end user can view these training sessions at their convenience. Once they have completed the online introductory courses, we provide a group training and question and answers. Physicians will be provided individual training at their request. This concludes this presentation. Thank you for taking the time to listen to me. I'm Bill Wade, of course, and I'm the owner of Telemedicine Florida. So if you would like to reach me or have any questions, please email me at bill@telemedicineflorida.com, or you may call me at 727-421-2540. Thanks again, and we look forward to hearing from you.